Good afternoon, everyone. Thank you for joining today's webinar, where we'll share the key findings from a large quantitative survey conducted in January 2015 by Shapiro+Raj and GiftCard Partners. I'm Sarah Hunt, Education and Engagement Leader for the Corporate Health and Wellness Association. As all of you are aware, one of the hottest debates in the wellness space is around intrinsic versus extrinsic motivators. Today's webinar will help shed light on this. We will discuss and share from the survey results what works to keep the population and individual engaged in changing their behaviors and gaining compliance, the type of incentives that truly engage, employees' adaptation to recent changes in the healthcare delivery, patient-centered initiatives, and the role and impact of incentive-centric programs and support. I'd like to start today's webinar by welcoming our presenters. We have three. We have Matthew Smith, Vice Chairman at Shapiro+Raj, Deb Merkin, Co-CEO and Co-owner at GiftCard Partners, and finally, but certainly not least, Ms. Sally Luck, HR Director of Corporate Services and Wellness at Hallmark Cards. Matthew Smith has been helping clients solve complex strategic problems for over 40 years by orchestrating global research in a broad range of business categories and bringing his understanding of customer and consumer behavior to the retail and B2B categories. He has conducted groundbreaking research in the development of big box retailers like PetSmart, the Sports Authority, and Staples, as well as pioneering work in health and wellness for the American Cancer Society, the American Medical Society, and the National Cancer Institute, including the first comprehensive study on the utilization of unapproved methods in cancer treatment. Deborah brings more than 25 years of experience in B2B channel development, partner programs, and marketing management. As co-CEO of GiftCard Partners, she works with her team to build their merchant clients' B2B gift card business, increase top-line revenue, and strengthen brand awareness and drive new customer acquisition. Our employer case study today is shared by Sally Luck, who has been employed at Hallmark for many years. She has helped strengthen Hallmark's culture of wellness and has been a speaker with us at the CHWA's annual conference for the past 4 years, so one of our favorites. Today's webinar will be available 48 hours from today. We'll be combining the PowerPoint with the audio and be emailing a replay to all of our participants. You can listen to it again, share it with your colleagues. You may type your questions into the Q&A box at any time, which is in the bottom right-hand corner of your screen. We will have a short Q&A segment at the end of today's webinar where you can address your questions to Matthew, Deborah, or Sally. And so without further ado, we'll get started, and I'll pass today's webinar over to Matthew Smith with Shapiro+Raj. Matthew?
Thank you, Sarah. And good afternoon, good morning, wherever you are. We have a lot to cover, and I'd like to get through it so that we do have some time at the end. But let's start out by telling you what we're going to be presenting, because it reflects a couple of different pieces of research. One of them, which is going to be kind of the heart of our presentation today, comes from a study of 50 companies that we conducted earlier this year. And it really was conducted mostly with the director or C-suite level of a respondent. We really wanted to understand from the perspective of the people really responsible for, and whether it be for the actual management or, you know, how it fits into the corporate finance. So we talked to a lot of VPs, CFOs. We talked to CEOs as well as health benefit directors and managers. We got a good range of company size to, you know, small companies, more mid-size, and even companies over 500 million. We've got quite a few in here that are even over $1 billion. And this study was conducted actually in the summer, but we're also going to present some findings from a pretty groundbreaking study we did with PNC Healthcare, the bank, about the future of healthcare. And it's a large representative sample of all U.S. households. and balanced by key demographics. That was conducted earlier in the year. What's not up here, which many of you joining the call today would be interested in, is we also, working with Sarah, sent out the same questionnaire that we asked of the C-suite folks. We sent it out to the membership and got back about 130 responses, which actually some of you may have actually done. So we're going to weave this story all together, and we'll be showing different data points as we go through this, and we'll pinpoint where some of the sources of the data come from. So just a brief overview of what the background of this the studies and the objectives were, but Shapiro+Raj and GiftCard Partners actually thought this would be a good program for the last Congress, and what we wanted to do was just explore the growth and impact of what companies are doing to improve outcomes in health and wellness programs, and with a specific focus on the use of incentives. It covered issues of the current deployment of health and wellness platforms, the level of usage and satisfactions with those platforms, as well as specific features and benefits. We wanted to understand how it kind of fit into the whole corporate culture and morale, and certainly Sally will talk a bit to that as well, and we'll show from the data what folks at other companies are thinking about that. Also, what are is the growth trajectory for health and wellness platforms specifically, and also the kind of benefits and features that are most likely to be identified for growth in the future. So, that said, when you talk about the future of health and wellness, it really is here, and it's here right now. The reason I bring that up is because we are operating in a world that has changed, and changed pretty rapidly. Certainly the Affordable Health Care Act has had some impact on that, but also the world that we live in has also had an impact. And you really can't look at the future of healthcare without looking at broader societal trends outside of healthcare. And those trends, you know, the advances in technology, just the way things are becoming more and more available at the fingertips of consumer. Also the way consumers source goods, information, and services. Retail trends do impact how people think about their relationship with the healthcare systems, their providers, and the things that they are likely to be doing in the future. Certainly there's a lot going on in terms of consumer trends that have a great deal of impact on healthcare. And indeed, many of those things, from minute clinics and online resources and portals, are all growing and growing rapidly, and do reflect a lot of these changes you're seeing more broadly in society. And the other thing that we learned, and this is pretty related to what I've seen in retail and what I see in a lot of other areas that I study around the world, but a lot of the locus of control is shifting from outside the PCP to the patient. And that analogy, of course, is happening in retail. Much more is being put at the fingertips of the customer and the consumer, including how they control the information that comes through to them. Advertising, for example, is very different today than it was even just 5 or 10 years ago. But the old model was, you know, patient discovers an issue, they visit their doctor, the doctor says, I'll take care of this, or you need to go see a specialist, or maybe even go to the hospital, and hopefully the issue becomes resolved. It was a very linear and very much controlled by the doctor or the healthcare system. That is changed significantly. From now, when a patient discovers an issue or even now thinks they might have an issue, very much going into a digital world to begin to explore what's going on. And they now may consult with more than one provider. Many don't even have a PCP. So they're really doing a very different way of approaching the management of their own health. They're making decisions, and those decisions are coming back and wrapping around to reviewing and deciding on next steps. So what you see in the broader societal trends with technology and retail and many other ways that consumers navigate in the world is definitely being seen in healthcare as well. So, for example, let's just take the way consumers are adapting to new healthcare realities. It's been only recently that consumers have the option now to really resource health care and services in a variety of ways. So, for example, retail clinics, absolutely growing. No surprise that it's growing quite rapidly, with 1 in 3 millennials actually having visited a retail clinic for their health care, and slightly smaller number even among the Gen Xers. But even among seniors and boomers, you're getting close to nearly 1 in 5 who are getting health care support through retail clinics. Patient portals, 1 in 4, almost across the board, are now adapting to more electronic communications with healthcare providers, their insurance providers, their doctors, their hospitals, and electronic medical records now are becoming the norm, and that is regardless of generation. So consumers are adopting new and different ways of resourcing in the area of health. It's no surprise that the high cost of healthcare is the most pressing challenge for consumers. And when you look at, in our large-scale survey, more than any other factor, the issues of cost are weighing heavily on consumers, and it also is weighing heavily on what they want from their healthcare providers. And millennials, for example, are very much more likely to actually ask for cost estimates when they resource healthcare. And that is only going to grow as consumers are really put in the position of taking the wheel. And our large national scale survey says that they're ready to do it. The question that was raised in that survey is, how ready is corporate America to help them to reach their goals? So before we get into some of the data, I'd like to turn this over to Sally to talk a little bit about how Hallmark is approaching what we've just talked about in terms of the emerging trends in healthcare and resourcing.
Thank you, Matthew. I'm happy to be here, and happy to talk about our program a little bit. And at this point, I'm going to focus on our incentive program and how we're structuring it and how it's evolved over the past few years to coincide with some of these trends. And first of all, I want to say I think the consumerism is very important, not only to the end user, but also to corporations. operations. Being able to compare costs, doing research online, and being knowledgeable about options is very important to us in terms of training our employees and educating our employees and to help control costs overall. But we've had a wellness program for many years. We've had an incentive program since 2011. And the way we've evolved that program over time to sort of keep up with these trends is we started with awareness. So in 2011, we encouraged people to really identify their health risks. And part of that was to participate in our on-site biometric screenings, which we had done on-site for a long time here at Hallmark, but really focusing on encouraging people to kind of know where they are, know their numbers, and at least take a start. And for that, we rewarded them. We provided a small incentive. Then in 2012, we began to really focus on the consumer education very hard. We did sessions in all our locations that were paid time to just educate people about preventive services that were available at no cost to them, both that we provided in our own medical clinics and our own on-site screenings, et cetera, through our health portal, and also that were available from their physicians. In 2013, we really began focusing on prevention and focusing on educating people again on what were age-appropriate and gender-appropriate screenings, how frequently they needed to be done, and offering many of them on site again, and also encouraging them to establish relationships with primary care physicians, because we do think that relationship continues to be important, and particularly as more and more people are insured under the Affordable Care Act, and there is a shortage of primary care physicians, we wanted to make sure people really understood that. And then in 2014 and 15, we have begun to simplify our rewards and incentive program and really place emphasis on healthy outcomes and reducing risk. So we really started with awareness, and we moved toward action all along throughout that continuum. We focused on incorporating wellness and well-being into our culture, and now really, and then throughout that time too, education and prevention, and now really making sure that people understand that they're accountable for their own health and that we expect them to achieve outcomes. So in 14, for the first time, we started rewarding people for healthy blood pressure and BMI, or for making significant progress toward a healthy range. And have that accounts now for 150 of our total $400 incentive payment that's available to employees. So that's how we're responding to some of these trends, and I'll talk a little bit more about what we're seeing as results as we go through the presentation. Thank you, Matthew.
Thank you, Sally. So now let's go through some of what we learned. And it's no surprise, 100% of all the companies we talked to offered some form of employee benefits, from insurance, 401k programs, very strong disability life insurance. But over 60%, almost two-thirds of the companies that we talk to say that they have a health and wellness program or platform that allows employees to do the kinds of things that Sally is talking about or shared with us. And they say that they have a health and wellness rewards plans in place. And 2 and 5 have an operational platform that they claim for doing that. So 60% offer rewards, 24% offer other incentives, about 16% said they had no plans. Of those who do have a platform and offer these, this is among the C-suite and the executive level. their feeling is that the majority of them claim that it's managed by a third-party provider on the outside, or a mix of both internal and external. The reason I bring that up is because when we talked to you and asked the same thing, it was pretty similar. 54% claim to have offer some reward program, but when we asked who's managing it, there seems to be a little disconnect. From your perspective, you're doing the management mostly of this internally. You may have outside support for doing it, but the executives at top level think someone else is doing it. But when you answered, you claim that you're actually doing that, much of that internally. And speaking to what Sally was talking about in terms of really the proof is in the pudding, getting engagement is the key way that you measure the success of these programs. And the percent engaged is actually from the perspective of the C-suite and the executive level, is that nearly 2/3 are engaged, and that key metric of engagement is really the key metric that they look at for success. The more people that are engaged is probably the hallmark of whether or not you have a successful program or not. But 2/3 do talk about completing HRA and screening are also quite important. And again, from the executive level, you know, the hope of lowering costs is another metric that they look at. Lower absenteeism, although about 1/3 say that that's a metric, it's still, you know, for 1/3 of these companies, they do look at hopefully that impact also being a metric for measuring success of these programs. And most of the employers with programs that we talked to expected increased participation. Sally will talk a little bit more about that later on. But in 72% say that they believe engagement to grow, and nearly 1 in 10 are forecasting that engagement will increase significantly. So to that end, Sally, do you want to talk about specifically about participation at Hallmark?
Sure, happy to. So the measures that you see on this slide are really the measures that are associated with earning incentive points. And some of them compare favorably and some not quite as favorable as the slide that Matthew just showed. But we have about 82% who participate on our portal. And just in reference to the slides about who manages the platform, we do have one of our subsidiary companies, Hallmark Business Connection, that provides our portal, and it's very comprehensive. It provides a lot of opportunities to engage employees, as well as a central location for a lot of the wellness information. They can take their health assessment on it. It contains their measures for the biometric screenings and weight and blood pressure and that sort of thing, as well as a lot of educational opportunities, workshops, and a dietitian online, diet plans online, recipes, as well as a place to redeem their incentives. So there's a lot on the portal, and we really want to drive engagement with the portal. So we did have 82% participating on the portal. 61% completed their health assessment, and that number really increased once we did have the health assessment incorporated into the portal, and we began giving, a fair number of points for it. 52% completed wellness visits. We'd like to increase that a little bit. 54% established baseline measures for their weight and blood pressure. Now, a fairly small percentage actually achieved the goals in the first year, and we're just about to remeasure those for 2015. And then we have 44% who completed biometric screenings on site. So these numbers have all increased over time since we first started with the portal in 2014, and we actually made some pretty nice improvements to the portal this past, well, in 2014, and so that really did affect participation at that time. So we're looking toward probably staying fairly similar to this in 2015, but we're pretty happy with these numbers, with most of these numbers anyway. Okay, Matthew?
Sally, thank you very much. Mm-hmm. So, if you recall, one of our objectives here was to understand how these programs kind of reflect the corporate DNA. A lot of the executives we talked to really believe that these types of health and wellness platforms and programs really are a part of their brand culture. 73%, 3 in 4 believe that. And interestingly, for EHBC respondents who participated, they agree. They believe, 70% believe that these health and wellness platforms are a part of their brand culture. And you see some of the comments that came out of it. You know, we are an employer who cares about employees. We view them as part of the family, and health and wellness is a way to help our employees live longer, healthier, and more active lives. So the real effort on the part of the company to utilize these types of programs to really help their employees, and the belief that there's a connection between health and the well-being of employees and the value that can bring to customers and shareholders. So there's a lot of potential and a belief that these platforms really do serve a greater good and really do connect with the company's corporate culture. And so far, the belief about their impact has been overwhelmingly positive. 88% said that they believe their health and wellness platform really has had a positive impact. And again, this is at the executive C-suite level, who believe that this is helping in looking at metrics of engagement and reductions in claims and lowering costs, absenteeism, and they believe that they're seeing it also through surveys and actual measurement of how employees are feeling about it. And a little later, we'll talk to the fact that employees also expressed that in the large national survey that we did. And for example, the quote, "Our program is incredibly successful." As Sally had pointed out, you know, it is an evolution, but over the last 10 years, participation and claims costs have both moved in the right direction. So it's not just their general feelings, but it's actually the evidence seems to be pointing in that direction that the impact is positive. So let's talk again, Sally, a little bit about the Hallmark Health vision. And we've talked in the past, and you can speak very well to what we just talked about overall of how that works at Hallmark.
Okay, thank you, Matthew. So Matthew talked a lot about culture and having your wellness program reflect your culture and be a part of your corporate culture. When we really started looking at what our vision for our wellness program should be, we looked to our corporate vision statement, which is to make a genuine difference in every life every day. And so what we came up with was pretty aspirational as well, but what we wanted to do was inspire a genuine commitment to personal health and well-being for every employee every day. And when we want to go to the next slide, Matthew, please. When we look at our what our Hallmark brand stands for, both as a consumer brand and as an employment brand, it is really about enriching lives. And, you know, we have a very well-respected brand. It's almost revered, I think, to many people. And so that brand equity is very important to us. And our founder, J.C. Hall, and some of you might have heard me speak about this, he started the company in 1910. And he was so visionary in so many ways. I mean, he really understood that happy, healthy employees were more productive. And he built the company to promote that culture and lived it every day as long as he was alive. And to the right there, you see some of our brand attributes, and really three of them, genuine, emotionally relevant, and life-affirming, deal directly with well-being and enriching lives and enriching relationships. So we really try to focus not only on physical well-being, but on the overall experience of a satisfying and meaningful life. And so that's really a key part of our wellness program and what we strive to do every day, and upholding our brand and kind of fulfilling the pledge and the vision that our founder had for his employees. I'll turn it back to you, Matthew.
Thank you, Sally. Deb, are you... now we're getting into the nitty-gritty of some of the things that our respondents told us that they are doing and where they see growth coming in the future, their planned growth. And Deb Merkin from GiftCard Partners can talk a little bit more about, because she worked with us to kind of identify some of these individual aspects and features. So, Deb?
Right. So what we're seeing here is, at the current time, as Matthew alluded, a lot of the companies were looking and are still doing something called, you know, reducing the premium that the employee pays, or cash incentive. And I'm really concerned about that, because I know in incentive culture and reward attributes, what really matters is that there's a trophy value on the reward. I'm sorry for the background. So that the cash incentives really don't work in the long run, and you can see that by as the C-suite people are looking forward in their growth plan. They're doing more with wearables and gift cards and reducing that premium. I ask you, how many times do you remember in your last paycheck what your deductions are, and whether you'd remember where you spent, that you got $30 more a paycheck? So I'll take it over to you, Matthew, now.
Sure. And to continue on that note, what Deb was referring to, and we believe that when we did this survey that actually there's kind of a mesh between points and gift cards and other types of incentives. But clearly from the executive level, that's where they see a great deal of growth in terms of trying to adapt and develop more ways to incentivize. And I think the real interesting thing to me was the difference between EHBC members and the C-suite folks, is that the belief in cash incentives was rated much lower than the belief in many of you who perhaps are dealing with these programs day in and day out. But clearly, the highest rated value in terms of the impression of the value to the actual employees was the gift cards and, you know, the tangible things, you know, wearables. Reductions of premiums are important, but as Deb points out, those are things people can't remember, whereas the trophy value of actually getting something, consumers and employees do remember those things. And so it really puts the onus on the really being strategic and deliberate, particularly when you have a very diverse audience of employees, from millennials up to seniors. There's more seniors in the workplace too, of really what are the offerings and features and benefits and rewards that are going to be most meaningful, and most meaningful to the consumer, but also most meaningful in terms of actually impacting behavior. And so those are issues, that Deb and others in the industry are looking at to really understand how can you really be really smart and strategic about your incentive platforms and formats and the content of what folks really want. We'll talk a little bit more about that later. Most of the companies we talk to believe they are in line or at least ahead of the curve. About 1 in 5 feel that they are behind the curve, and certainly those that are not offering some type of program rate a little bit higher there. But those who are currently offering some kind of program, it correlates very strongly with where they feel they are in terms of being up to date and with the times in terms of what they're offering to their employees. This is interesting, as Sally pointed out. They're at about 400, and it's interesting. It was very close, not only to what you as members of EHBC told us, but also what the folks that we talked to at the executive and C-suite level believe that they are spending on average on their incentive programs for employees. So very close, very much in line, no matter who we talk to. And here's where I want to get a little bit in, and Deb, you can pipe in and talk with me about this, because some of this is from another survey that Deb and I worked on the B2B incentive card programs. But when we talk to employees in our large survey, about half, a little less than half of employees reported that the company they worked for had a health and wellness program. And of those, a third said that that program includes some kind of reward or cost incentive for participation. But again, just as you saw the executives and even EHBC membership feeling that they have a very positive impact, employees do too, feeling very favorable about those kinds of programs that their companies offer. And importantly, why is that trophy value so important, and why are these incentive programs important? Is they really do speak to some very fundamental emotional connections to both the company and also how they feel about the way the company thinks about them. So very strong ratings for those kinds of incentives, making them feel loyal to the company, making them feel like it's something I deserve and you recognized it. And recognition is really, I believe, a very important part of programs like this. And these incentives are seen as worthwhile. Yeah, go ahead.
I'm sorry, Matthew, to interrupt. The way that you recognize people and what you and the choices that you give them, which is why something like gift cards is always a good thing, in the reward value so that they can choose what's important to them is so important, and the way you recognize them. So the research shows that if you recognize them in public and your manager or the CEO for that matter says, gee, Deb, you stopped smoking and you've kept it for 6 months, we're giving, you can choose, you get so many points and you can choose a gift card or a reward of your choice. And that is great in both ways. It's the way that they did it. They gave them public recognition. And the second piece is they give them choice in what they can choose, because with a wide variety of demographics and ages in the workforce today, you have to assume that each one of them is going to look at it differently, a millennial versus, somebody over 45, and what they want is different.
Absolutely. And that was a little bit a continuation of what I talked about before, is the onus on the employers to really understand what does motivate. And as Deb points out, certainly in this more consumer-centric world that we live in, choice, putting the choice into the hands of the consumer is what everyone is trying to do, and certainly technology is helping to advance that rapidly. And is really it's a disruptive factor in so many areas, whether it be retail and online purchasing, and even, contacting even brick and mortar stores and being able to go online first or pick things up. So giving the choice is a very powerful way to have employees feel like you are recognizing them and you care about not just their health, but that you care about listening to them and understanding those things that are important to them. And of those employees who reported that they had an incentive program, again, almost two-thirds claimed that they took advantage of it. They received a reward. And the highest thing that they recalled was the gift card and a cash bonus. Go ahead, Deb.
I'm so sorry. If you want to assume that you're going to increase engagement, I think, Sally, you can also speak to this later on, you need to be able to give your employees a continual reward in some way, shape, or form. Again, the reward that they choose is the best engagement that you can do in the way you do it. So gift cards are a great reward, but you have, in order to continue the engagement after the early, getting everybody on the bandwagon through a health fair or whatever, continual engagement, you need to help them along.
Yeah.
Go ahead, Matthew.
Very good point, Deb. And again, along that line of choice, the gift cards, nearly half say that that's what they redeemed. And most commonly, it's prepaid debit cards. Again, giving them a choice because that's something that is not necessarily for one place, but allows them to decide how to utilize that reward, putting more of the...
Matthew, could I add something here? The prepaid debit cards are great because they're easy to give. On the other hand, prepaid debit cards are, again, like cash, and sometimes when you're looking at true engagement, they don't remember what they did and spent on cash, but if they got a reward to go to CVS or Whole Foods to pick out dinner for their family, that's something that they can share, and the reward value and the trophy value goes up from there.
And that's a good point. And the reason that's a good point is because I believe currently the most common being prepaid debit card, simply because from a corporate perspective of trying to decide what to offer, it is the easiest way to do that, but I believe there's going to be greater rewards in offering perhaps more varied and widely other choices that the consumer can choose from. That so, for example, online retailers are very popular also as cards. But I think, again, the better that the companies can become at really providing a wide assortment of ways that the employee can feel rewarded is probably going to be the trend for the future. So at this point, I think, Sally, you were going to speak to this.
Yes, yes. I'll be happy to share what our experience has been in fostering engagement. So we give a lot of choices. When we first developed our program, we felt strongly, and I think our C-suite felt strongly, that we needed to have a paycheck credit as an option. And luckily, we did have our partner, Hallmark Business Connections, that offers a gift card redemption. And they have a lot of choice with these gift cards. I think there's something like 150 different merchants that they can choose from, both local and localized to a particular, geographic area, and national retailers. So our experience is that about 2/3 of the redemptions have been for gift cards. And just this year, we offered a health savings account, and I believe that is a pretty low percentage, and it's really limited to those who are in a Bronze Plus or a high deductible medical plan. But we see and we hear, the anecdotes about, oh, I save my money up to buy shoes from Zappos, or I save them up until the end of the year and give them for Christmas gifts, or give myself a reward. And so I would really echo what you have heard Deb and Matthew say, that it is much more valued to the employee to have a reward for themselves, as well as to have the choice as to what to spend it on. So we offer the choice. We also offer immediate reward. We allow employees to redeem after they earn 25 points. So if they want to save it up, they can, but they can also just take the health risk assessment and redeem for that. And we use that tactic in our challenges too, which we do about 3 or 4 challenges each year, and these are incented outside the portal, but we do weekly drawings for small prizes, so $10 gift cards, or bags of some of our cool product, and that seems to be really helping to keep people kind of interested, and kind of provides that element of surprise for them. But then to keep them engaged for the longer term, we have grand prizes that are anywhere from $100 to $500 in value, and these are gift cards, and that really seems to ensure their longer term engagement. I think another key is really having a well-integrated program that has both easy to attain and more difficult to attain goals. So we might have, attend an hour-long seminar and get 10 points, or complete the personal health assessment and get 30 points, or we might have, achieve a healthy BMI or achieve a healthy blood pressure for 75 points each. So I think having a mix of easy and difficult to earn, and having that incentive be appropriate for the effort required is very important. And we do try to make sure that they earn points from each category of our rewards, and those are prevention and education and outcomes. So I'll let you go to the next slide, Matthew. So some of the changes that we made in 2014 were we did implement this new portal. We also increased our rewards. So we've gone up over the years from 250 up to 300 in 2014 and 400 in 2015. We introduced personalized health tools on the portal. And what this means is that based on health risk factors that are identified by metric screenings and the health risk assessment, they are assigned certain activities and workshops that are tailored to their own health status. So that's the kind of the educational piece. And then the outcomes piece is, again, is the, the prevention and the achieving the healthy ranges. Next slide, please. So here's just a diagram of kind of our path to 400. Again, prevention, and we do include points for both the employee and the spouse or domestic partner, and that's for taking the health assessment, getting an annual physical, participating in on-site or patient service center wellness screenings, and so that's, you can earn up to 180 points for that. And then the education piece, you can earn up to 200 points for that, is health coaching, which we offer here on site. We offer an on-site dietitian as well as our occupational health nurses to do coaching. They can take those wellness workshops on the health portal and then attend. We have a lot of lunch and learns, and also record them, and so they can watch streaming videos or check them out and take them home. And so for that, they can earn 200 points. And then for the final 150 points is the BMI and blood pressure. And the way we handle that is in the spring at our biometric screening, that is automatically recorded as a baseline number, and then they have 6 months to achieve the healthy ranges or to make significant progress. If they're healthy in the beginning, then they automatically qualify, and that would get paid out to them pretty much right away. But if they're not, then they have the time to work on it, and we have the outcome period end October 30th, and then we pay that out pretty quickly after that. So that's kind of the way in which, I mean, you can see these to add up to more than 400, so you do have an opportunity to earn, more points in different categories. However, that last 150 has to be earned by outcomes. So I'll let you go on, Matthew. And just talking about some of our results, I love this because this shows from 2010 to 2013. This is a cohort group that received our biometric screenings in both of those years. And for the group that was at high risk for LDL cholesterol, 75% of them moved to moderate or normal risk levels. For glucose, 54% moved to normal or moderate. And for the A1C, which many people say is a better indicator of glucose levels because it measures it over a longer period of time, 75% of them improved. So those are showing some very good results from people being engaged in the program and really taking action. Next slide, please. We also had some information comparing last year and this year, and this was for people who both completed the health risk assessment and took the wellness and did the biometric screening. And this was 1,725 employees, and of those, 79% either improved or stayed the same. So you can see down at the bottom there, 20% improved and 59% stayed the same. We also know that in this group, about 32% were classified as healthy and fit with no risk factors. This is sadly better than the national average. And also our health risk percentages are favorable to national averages in the area of blood pressure, diabetes, obesity, and depression. So we really think that this success is due to our culture of wellness that we've developed over the years, and also the fact that we provide this integrated wellness program, and it encompasses a lot of different factors, a lot of different ways that they can become engaged, and also a highly effective incentive program that provides a lot of choice both in how to earn points and how to redeem them. Next slide, please. So just to wrap this up, we're getting close to the end of our time, is just some key takeaways that we'd like to leave with you today. Health and wellness programs and rewards really need to affect the changing wants and needs of the workplace population. All the way from millennials to boomers, they have different needs, they have different wants. One size definitely doesn't fit all, and we need to understand that. And then also a choice of reward options is really critical for engagement. And what we're seeing and what the research sees is that the tangible rewards through cards and points are the most effective in engaging the workforce. Also, we can affect outcomes. We can affect behaviors by the design of our incentive program. And also, and probably most importantly, it really needs to be in sync with and reflective of your corporate culture. And you need to build on your corporate culture with the design of your program and with your ongoing programming. So at this point, thank you. I think I need to turn it back over to Sarah for a couple minutes of questions at least.
Yes, absolutely. Well, thank you, Matthew and Sally and Deb for sharing the results of the survey and then also for your own shared experiences. We've got a lot of questions actually around, the taxes, taxability of gift cards. So how do you handle taxability of gift cards and paycheck credits? Actually, before I address this, I just do want to remind everybody, you can begin typing your Q&A, I apologize, in the Q&A box on the bottom right-hand side of your screen. But again, panelists, so the first question, which we've received many questions around, is how do you handle taxability of gift cards and paychecks credits?
Sally, do you want to take the beginning? Yep.
Yes, I will. The way that we handle it is that the paycheck credit, the gift cards are taxable income. And that's just how we've been advised by our legal folks. The HSA contribution is not taxable income. But again, it's related to being enrolled in the bronze level high deductible medical plan.
Right.
Yep.
And this is entirely up to your accounting and lawyers to decipher, so that's the way that Hallmark does it. There's a piece in the Accountable Care Act that started in 2013 that says that 30% of the health care dollars in corporations can be used as incentives. So I am not a lawyer and I don't profess, but there are some companies that look at that as the incentive portion and use that up until a certain amount of money, usually $250 or $300 per employee, as non-taxable.
Okay. So we have another question coming in. It's how do you determine the point structure of your rewards program?
Well, as I think I covered in my presentation, it really is, it needs to be varied, and there needs to be a lot of different ways that people can achieve points, because you really have to meet people where they are. We've chosen to focus on prevention, education, and outcomes, and I think it's important to have, ways in which people can earn points in every single one of those categories, but we are really moving toward outcomes because we've been doing this for a while now. We've been educating people and measuring participation, and now we're sort of expecting them to take accountability for their own health.
Okay, thanks, Sally. This next question's from Jane, and I think, Matthew, this might be something for you. I think it was in regards to the average. What is the breakout of the $400? Does it include insurance premium reductions?
Can't answer that question. We just asked them in total for their incentive rewards, about how much are they spending per employee. So it was just a lump sum average. Perhaps Sally might be able to talk a little bit more about how that
well, yeah, we don't necessarily do a premium reduction. The paycheck credit option is meant to address that, but that is only, about a fourth of our redemptions is in the paycheck credit.
Thanks, Sally. We have a question from Kirsten. she asked what dollar amounts are you typically seeing with incentives, what format and what percentage does that drive? She states that her company offers gift cards, but are you seeing other incentive offerings that work especially when additional tax is concerned from an employer?
I'll take that. All of the incentives, whether it's a gift card or a wearable device or new pair of sneakers, are under that same act, and each company has to decipher that ruling for themselves. Generally, again, there's a certain dollar amount that they will go after and do. About that $300 range before they start taxing them.
Okay. Thanks, Deb. Heidi asks, how do you accommodate people with disabilities in your programs?
I'll take that one. We do have a workaround, and we make that very clear that if someone can't achieve the outcomes, then they can actually get a written exception from their physician, and they work with our medical department, our occupational health nurses here, and they will provide that credit for them. The other thing that we allow is if a physician says that it would be unhealthy for someone to meet the BMI requirements, then we will waive that. We will waive the requirements on that. We don't have very many people who ask for exceptions, and I think by having a varied program, as you could see, you could actually earn $250 by doing many different activities. We felt that we designed it so that just about everyone could actually achieve that $250, and then going above and beyond that, it really takes a lot of effort. But if there truly is a reason that you can't do it, then we will allow exceptions to that.
Okay. Sally, here's another one addressed for you. Is how did Hallmark determine how many points would be assigned to the completion of an activity, for example, an HRA?
We have a wellness team, and that team works very closely with our team at HBC, and so kind of based on what we learned were best practices and their experience, HBC's experience, as well as what we had done in the past, we look at that every year, and we have increased it and changed our point allocation over the years as we see, what's really working with people, what's engaging them, what are we learning from others who are doing similar things. So it's really kind of a team decision that we come to in terms of what are each of those point allocations going to be each year.
Excellent. Holly asks, do the employees enter their achievements on the honor system, or how is the information verified without violating HIPAA?
Some of it is on the honor system. We formerly were able to get some data from our health plan provider. We have gone to a fully insured status this year, and we have a few different providers, so we're actually not able to get that data directly into the platform any longer. So things like the physician appointments and some of the other screenings, we do allow to be entered on the honor system. Things like attending the workshops that are here on site, they enter in the honor system. And then like the workshops that are on the portal, that's automatically, goes through the portal. So once they complete it, then they earn the points. Also, the biometric screening and the personal health assessment, those go directly to the portal. So that's not the honor system. So it's really a combination. The outcomes piece is measured by the biometric screening initially, and then if they don't meet the requirements, they work through our medical departments, and they have to have the validated measures that are then uploaded into the portal. So it's a combination of ways.
Mm-hmm. Thanks, Sally. We have time for one more question, and for those of you whose questions we have not had time to address, we will be following up via email, responding to those. Amber asks, so how do you get people to do the program for the right reason, for their overall well-being and not just to get the gift card incentive?
That's a really good question. You know, I think it goes back to that creating a culture of well-being and making it be, you know, the thing to do. I think part of it too is related to the marketing that you can do and really keeping it top of mind with employees throughout the year. You can't just do a health fair in the spring and then don't do anything else. You have to keep the awareness all throughout the year. You have to keep beating the drum, if you will. And I think what we've tried to do is have a focus each year. And so we keep repeating what that message is for the year. So if it's prevention, or if it's healthy outcomes, or if it's knowing your numbers, they're hearing that from us throughout the year. We also do a monthly newsletter where we try to put a lot of really, compelling information in it and links to other sources so that it's interesting for people. It also has listings of the events that are upcoming that they can earn points for. So we try to, make that a piece that where we can really, get the word out to people and keep them engaged and interested in what's going on. The challenges are a great way, that with a little bit of financial incentive that's different from the normal incentive. I think that has been a real engaging factor for employees. We did a walk to the moon was our first one, and we had a huge participation in that. So it is challenging, though, because you have to keep them fresh and you have to keep coming up with new ideas to keep people engaged.
I think, although I do not run these platforms, but just thinking about my work in consumer behavior, even if they're doing it for the wrong reasons, it's up to you that, as Sally says, if you've got the content and the ability to engage, the fact that they're engaged still is an opportunity to get those messages across. Even if their initial thing is to simply, just try to get the gift cards, they are coming to the platform to do that, and it does allow you to at least get those messages and that content that could hopefully over time sink in.
Excellent. Well, thank you everyone for your insightful questions, and to Matthew and Sally and Deb. Before we close today's webinar, I do have some special offers that, on behalf of GiftCard Partners and the Corporate Health and Wellness, we'd like to extend, again, for our dedication and assistance in helping to educate each and every one of you. We would like to recommend you save the date for our next annual conference, which will be taking place in Washington, D.C., September 25th through the 28th, where you can hear live and in person from experts like today's panelists. We are the largest corporate wellness conference in the country. Our recent event had over 2,500 attendees. You can hear from over 200 influential speakers, hear from or attend over 20 sessions, again, dedicated specifically to corporate wellness, corporate fitness, corporate nutrition. So definitely recommend attending and hearing from some of the leading employers. We're really known for our collaborative forums, forums focused on healthy eating in the workplace, healthy foods, on-site clinics. And for the third year, we'll actually be having, again, our fitness wearables think tank. This year, it will be in 2016, actually, we'll be hosting our second annual Healthiest Employer Awards H100 ceremony in partnership with Healthiest Employers. This year, however, we are extending the opportunity to sit in and hear from the top 100 healthiest employers in the country, absolutely complimentary. Each and every one of you are invited to attend as a registrant to this year's EHBC conference. And so what we'd like to offer you today, if you're an employer, is a complimentary pass. Use the code GOGCP and register before Friday, November 27th, and receive a free pass. For non-employers, you do have the opportunity to save over $699 if you register today and before February 1st. Again, I can't thank each and every one of you enough for your participation in today's webinar. If you have any additional questions, please feel free to call or email Matthew Smith with Shapiro+Raj or Deb Merkin with GiftCard Partners. I'd like to give a special thanks to Shapiro+Raj and GiftCard Partners for sharing the results of your survey, and a special thanks to Sally Lux for sharing Hallmark's experience with incentives. So thanks everybody again, and hope you have a great rest of the afternoon.
Thank you, and happy Thanksgiving.
Thank you. Bye-bye.
Bye.